The lines that I had here on my face prior to Restylane were very deep, and I honestly didn't know what could be done about them. I hated the way they looked, and ever since I've had the treatment with the Restylane, right over here on my face, they're gone. I look much younger. I feel much better. I wanted to show off my new look to everybody, everybody from family to friends. I've had many compliments, and recently I've ran into some friends who I haven't seen in a long time, and the first thing they said was, "You look amazing," and of course they couldn't quite figure out what was different. My greatest concern before having any Restylane treatments was probably pain or an unnatural look. I wouldn't use the word hurt for the treatments. It didn't tickle, but it was very variable. After my treatment, I was able to resume normal activities. As a matter of fact, I felt great after the procedure, and I asked the doctor if I could work out later that day, and he said absolutely, and that's what I did. I think people do respond very favorably to me. I've got an overall youthful sort of demeanor and attitude now that maybe I didn't have before, so overall just a lot of confidence, and I attribute a lot of that to the Restylane treatments.
Important safety considerations of Restylane. Restylane restores volume and fullness to the skin to correct moderate to severe facial wrinkles and folds, such as the lines from your nose to the corners of your mouth, nasolabial folds. After your treatment, you might have some swelling, redness, pain, bruising, and tenderness. This will normally last less than 7 days, although rare, red or swollen small bumps may occur. If you have had facial cold sores before, an injection can cause another outbreak. In rare circumstances, the doctor may inject into a blood vessel, which can damage the skin. To avoid bruising and bleeding, you should not use Restylane if you have recently used drugs that thin your blood or prevent clotting. If you are pregnant, breastfeeding, or under 18, you should not use Restylane. Restylane should not be used by people with previous bad allergies, particularly to certain microorganisms known as gram-positive bacteria, or by people with previous bad allergies to drugs that have required in-hospital treatment. Restylane should not be injected anywhere except the skin or just under the skin. The use of Restylane at the site of skin sores, pimples, rashes, hives, cysts, or infection should be postponed until healing is complete. Use of Restylane in these instances could delay healing or make your skin problems worse.